Hi everyone, welcome to a video about dentistry for cats. A very important topic, as dentistry is very important to our health. But before we get going, please remember to squish that subscribe button and pet the bell notification icon so that you're notified of future videos. This is a video I've been wanting to make for quite a while because this is such a big part of veterinary practice in every pet's and pet owner's life. Dental care, dental health. So before we get into it, what I want to do is actually clarify some of the terminology I'm going to use during this video. So we always talk about dentals, dental cleanings, dental health. You've heard this, I've said it a million times, but what do I really mean? What we really mean when we talk about dental health is gum health. That's actually what we're worried about. We're trying to prevent periodontal disease, which means gum disease and gum inflammation. All the stuff we do with teeth, like cleaning them, evaluating them, extracting them, it's all done with the goal of maintaining healthy gums, because that's what actually matters. Our mouth is rich with bacteria, and those bacteria tend to stick to teeth. And when bacteria are stuck to teeth, they form something called a biofilm, which is like a really thin microscopic layer of bacteria that's basically like cement. It's on there, you can't get it off without an ultrasonic scaler, and that biofilm of bacteria gets brought into contact with the gums, and the gums become inflamed because inflammation is how your body responds to bacteria. And when the gums become inflamed, they eventually recede. This is called gingivitis, and when they recede, they never come back. So the whole goal of dental care is to protect the gums and not have them recede in the first place, and then of course deal with the consequences of gum recession if they do. Much like this cat might try to recede during this video, and we'll let him because we don't want to torture him too much. So Sir Lancelot has joined me today because he's due for a dental cleaning. So he's going to illustrate with his disgusting inflamed mouth why and when we need to clean teeth. Dentistry is a big part of veterinary practice nowadays. If you had a pet 20-30 years ago, you may have not heard much about oral health. Because this is something that the veterinary profession has really kind of come to, probably starting in the early 2000s. We've come to realize that if we're going to take care of animal welfare and health, we have to become dentists as well as everything else, because oral health is such a huge part of your overall well-being and overall welfare. I mean, the mouth is one of the major sites where your body interacts with the outside world. There's a huge immune system component in your mouth. And of course, a lot of bacteria is where food comes in. And oral health is really closely linked to our overall health. For example, there's a really strong correlation demonstrated both in humans and in cats between oral health and heart disease and kidney disease. So it's not a causative relationship, but we know that patients who have bad mouths are more likely to have heart disease and have more severe forms of heart disease, more likely to have kidney problems, and there's all sorts of theories about why that is. We know, for example, that diabetics who have periodontal disease have a much harder time managing their blood sugar. And in diabetic cats, we absolutely have to clean their mouth, because not only do they have a terrible mouth because the blood sugar in their system promotes bacterial growth, but then the bacteria and inflammation in their mouth makes the diabetes way harder to manage. Same thing with kidney disease. Cats with kidney disease, they're way harder to stabilize if they have a rotting mouth, right? So it's a really integral part of systemic health. So we manage oral disease for systemic health, and then of course also for local disease. What do I mean by local disease? I mean things like broken teeth. Dogs will break their teeth on balls and cages and sticks. Cats will break their teeth in car accidents, or if they miss a jump. Oh, Lancelot, you got places to be? Okay. Sir Lancelot needs to go for a little walk. Maybe he'll rejoin us a little later. Bacteria form this biofilm that covers a tooth. That's invisible, it's cemented on, it's impossible to remove without an ultrasonic scaler, and it is actually what drives inflammation in the gums. Now what these bacteria in your mouth do is they build a little house to hide in. And what they do is they draw minerals out of the saliva and build basically a deposit that we call calculus. And this is usually, when you look in the pet's mouth and you see like crusts on their teeth, or you see like brown staining or deposits, what you're actually seeing isn't the bacterial biofilm, but the calculus, the little house the bacteria built for themselves to protect themselves from the environment and the immune system. And you can have lots of calculus and still have healthy gums. You can also have really inflamed gums and no calculus, but that's what we mean when we talk about your pet has a lot of calculus in their mouth. And it is one marker that we use to determine when dentistry is appropriate, but it's not the most important one. The most important one is inflammation of the gums. But most of the time dentistry is recommended because a vet looks in your pet's mouth and says, oh, looks like they're about ready for some dental cleaning. Now what do they mean by that? So we have this grading system for oral health, the grade 1, 2, 3, and 4 that every vet is taught in vet school. Nobody's ever, it's very unclear though, we know there's a grading system, but what those grades actually mean is never really clearly defined. So I don't find it to be that useful in general, but in my own clinics, I try to standardize things by creating clear definitions for these grades of dental disease. And just so you guys know, this is for my practice group. This is not universally accepted, although it probably should be because it makes a lot of sense. Because the way we grade our patients' teeth is 0 out of 4 is just, perfect white teeth like a puppy or a kitten would have. Grade 1 dental disease is where you see any kind of deposits, discolorations, calculus on the teeth, but the gums are healthy. Grade 2 is where you see significant deposits, but the gums have not become inflamed yet. And then grade 3 is when there's any gum inflammation present. And then grade 4 is just basically an exclamation mark to let your colleagues know that, my God, this mouth looks terrible. And we recommend dentistry or dental cleanings when you get gum inflammation. So bad grade 2 or grade 3, as soon as you get gum inflammation, you know that that mouth is going to benefit from a scale and polish. And cats are kind of funny in that cats get something called lymphocytic plasmacytic gingivitis, meaning that some cats will have really bad gingivitis, really bad inflammation of their gums, even though their teeth look perfect. And there's, that could be a topic, whole separate topic for a video. But just so you know, cats may have significant inflammation in their mouth and may really benefit from dental cleanings, even though there's no like brown cakey deposits, no calculus on their teeth that is obvious that you can see. But those cats actually are the ones that really benefit from dental cleanings the most. Before we get going much further, let me break down to you what vets actually do when we do our scale and polish and dental cleaning. So what we do is we put your pet under anesthetic, and then we scale their teeth with an ultrasonic scaler, which removes the calculus, removes the bacterial biofilm. We get in below the gum line, 360 degrees around every tooth. We probe, after we do that, we probe the teeth with a little probe, looking for gum recession, looking for any pockets, any places where there may be like infections or abscesses. So we do it's called doing an oral exam. Then we do a polish where we take a little cup with a abrasive kind of like polishing paste, and we buff out all the microscopic scratches we just put into the teeth by probing and scaling them to make the tooth surface nice and smooth so that the bacteria have a hard time attaching to it and making the teeth look really nice and clean. And then we do dental x-rays. And dental radiography really should be a part of almost any dental cleaning. So then we do dental x-rays, and if this is just a routine prophylactic cleaning, and if there is nothing interesting found on the list exam, then we wake the patient up. And this often takes 30 to 45 minutes. So what happens if we do find something unusual on our oral health exam? Or if we did the dental because we know the patient has a broken tooth or a resorptive lesion? Well, in that case, vets we're pretty blunt instruments when it comes to dental care. Our answer to most dental problems is extraction. We simply extract the teeth. And this is really important for you guys to know. You can extract all the teeth on a cat or a dog, and they'll have a fantastic quality of life. They don't need their teeth to live. They can eat kibble, they can eat wet food, they can eat pretty much anything we feed them normally without teeth, right? Canines are only used for killing, so dogs and cats don't need their canines, although canine extractions are a pain in the butt. The molars, again, are used for chewing, but again, they can eat just fine and be totally healthy without any teeth. So we sacrifice teeth very readily. And stuff like endodontics and orthodontics, a little advanced dental care is available in the veterinary industry, but it's usually only done by veterinary specialists. And I mean, realistically, if you have like a police dog, then people maybe do like root canals on them to preserve teeth that are otherwise unhealthy. But if you have an average pet dog, a tooth is unhealthy, you just remove it. It's by far the cheapest and easiest and most straightforward way of dealing with it. So the way I deal with it is, because you can't really tell in advance what you're going to find when you go into a mouth. Like, it's always an adventure. So I always tell my clients that, look, here's an estimate for a cleaning, dental evaluation, and x-rays. This is pretty cookie cutter. It's going to be the same for every cat and dog pretty much. And then on the day, if we don't find anything interesting, wake them up, done, good. And if we do find a tooth or 2 or 10 that need to come out, then I'll phone you on the day and I'll tell you how many teeth need to come out, I'll tell you what it costs, and then we can make a decision together how we move forward. Because realistically, the cost of extraction can be huge. It can easily be thousands of dollars, because extractions in animals are very technical. They're basically oral surgery, and not simple oral surgery, because cat and dog teeth are very complicated. They have massive crown, their root to crown ratio is huge, much bigger than a human. So extracting a tooth from a cat or a dog is far more difficult on average than extracting a tooth from a human. Of course, this will vary by tooth. Sometimes, if you have a loose little incisor, you pop it out, we charge our client $50 for it. It's no big deal. Other times, it may easily take an hour to extract one tooth. You have to develop a gum flap, remove bone, section the tooth, elevate it out in pieces. If the tooth is infected and rotten, the root may fragment, and you have to dig out those roots individually. It gets really, really complicated. So it's really impossible to predict ahead of time how a dental will go. When we book dentals, we have a 4-hour slot for them. Sometimes it takes 30 minutes. Sometimes it takes 4 hours, and then we have to wake them up and bring them back another day to finish it. So very, very multivariable. But again, like with all else in life, just good communication is what gets the job done smoothly. So I think that's a very important thing for pet owners to be aware of, that when we talk about extractions in pets, it is not a simple process. It is often like advanced oral surgery that can take a really long time, which is why it can cost a lot of money. And again, if we just do the regular dental cleanings, most of that is preventable. If we just take good care of our pet's mouth and our pet's health, they can go through their life without really ever needing many extractions or any extractions. Not always. I just did Mr. Pirate's dental. I do Mr. Pirate every couple of years. I keep a pretty close eye on his mouth. And his most recent dental, he had 2 little tiny premolars that I had to remove. And I swear I was pretty much crying into my surgery mask as doing it, because I felt like such a failure that I didn't do his dental cleaning sooner and save those teeth. But realistically, he's a 17-year-old cat, and those premolars go very early on cats. So I think I'm doing an okay job with him, but I still felt bad about it. So you can't prevent all extractions or all dental disease, no matter how vigilant you are, is what I'm trying to say here. Claudia just had her first dental at the age of 4, so that's pretty common. Usually about 3, 4, 5 is usually when a cat or a dog will be able to benefit from the first dental cleaning. Lancelot gets his teeth cleaned probably every other year, because he's a little predisposed to gingivitis, so his gums turn red pretty early on. But he'll be doing that for most of his life. And I've never had to extract any of his teeth. I'm very proud of that, because we do stay on top of things. So it really just varies by patient what they need. And Sir Lancelot is back to talk about the next section of this video, which is how often you should clean your teeth. And that is a really interesting question. And the answer will be different for every patient, because periodontal disease is such a multifactorial problem. Oh, thank you for the headbutts. Yeah. Good, Sir Lancelot. It is a very multifactorial problem. There's lots that goes into it. Things like the kind of bacteria you have in your mouth, which largely influenced by what you inherited from your mother, your diet, your environment, what kind of blood perfusion you have to your gums, what is the mineral content of your saliva, how much saliva you produce, where your saliva glands open in your mouth, because we have high variability in our patients between how long or short their faces are. How your teeth are spaced in position, what your diet is. It just is a ton of different factors that go into this. So there's no clear-cut answer as to how often we should clean a pet's teeth. We just have to go based on what's happening in their mouth, based on veterinary qualified opinion and evaluation of the gum health. That is the only way to know. And some animals, like if you have a big, large breed dog, they may only need a dental cleaning like once in their life or twice in their life. Whereas on the other hand, if you have like a Yorkie or some cats, they may benefit from a dental cleaning every year, and it still get some periodontal disease. And some animals will get, just like humans, you have different They might have softer enamel, so they might be more predisposed to tooth loss and various other issues around the tooth. They may have oral trauma that you're not aware of that may predispose them to periodontal disease. They can get infections or systemic issues, again, like kidney disease or diabetes, that will make your mouth worse. So it's a really complex problem, and there's no clear-cut answer to it, but there is a very, very clear-cut way of that the veterinarian can look in your pet's mouth and figure out whether they need a dental cleaning or not. I've explained to you so far why dental care is important, how we assess a mouth, how often we need to provide dental care, and what we look for to make the decision about when it'll benefit the patient to go under anesthetic and have their teeth cleaned. And you as an owner can play a big role in this, because I mean, as I tell my clients, I show them what inflammation of the gums looks like. I'm like, you know, you can look at this, you can look in your pet's mouth anytime you want. You know, if you see a red line where that gum meets a tooth, if you see gingivitis, you know it's time to get those teeth cleaned. You know, it's a matter of education, and you guys can make that call almost as easily as I can. You may have trouble discriminating some of the minor nuances of dental disease, but you can, I think anybody can really look at a pet's mouth and say, hey, I need my vet to look at this. I think my pet is ready for dental cleaning. It's really not that complicated. At the end of the day, you know, gingivitis gets better with scaling and polishing. So if you have gingivitis, you should do scaling and polishing, right? And it's also important to be really proactive about dental health. As I said earlier in the video, it's all about keeping those gums healthy and keeping them from receding, because when they recede, they don't come back, and then when they recede, the tooth roots get exposed, and that's when you start losing teeth. So it's really important to be proactive, and doing multiple prophylactic dentals throughout your pet's life is infinitely preferable to waiting till the mouth gets really, really rotten and then having to deal with like multiple extractions and really severe periodontal disease. Because you're not saving money by delaying the dental. You're not reducing your pet's anesthetic risk at all by delaying a dental, and I'll touch on that in a moment. There's really no benefit to delaying dental care, and we know that pets are going to be healthier and your lifetime expenditures on dental care are going to be lower if you're proactive about getting those teeth cleaned regularly throughout your pet's life, rather than waiting till the end of life when they have periodontal issues, they have severe disease, and they might also have other diseases, other comorbidities that might make anesthetics more complicated, or they might make just the dental care more complicated. As veterinarians, what we do when we clean teeth is we put a patient under an anesthetic, and then we do a scale and polish, just the same as what happens when you go to dentist, except of course it has to be done under anesthesia, because no animal was sit there for 45 minutes with their mouth open, letting you get in their mouth and do your job properly. And I'm just going to take a small pause here to talk about the concept of anesthetic-free dentistry, because it's something that comes up a lot. And there's a very strong statement about this by the American College of Veterinary Dentists against anesthetic-free dentistry, and I'm going to tell you why, and I'm going to absolutely level with you guys. Trying to do dentistry on an animal without anesthesia is animal abuse. There's absolutely no other way to describe it that's accurate, because it is a cosmetic procedure. These people who say they do anesthetic-free dentistry clean your pet's teeth, what they're actually doing is they're just chipping away the calculus that's formed on the tooth. But of course they're doing absolutely nothing for the biofilm that's attached, that's the actual problem. And they can't get below the gum line or only inside on the lingual surface of the tooth, because of course the animal's awake and fighting them the whole time and probably in significant distress. So all they're doing is just, they're taking the roof off the house, but they're not doing anything to the inhabitants. It's a purely cosmetic thing to make things look better for the owner, while not benefiting the patient at all. It's also important to understand that when we talk about a dental cleaning, we're talking about a scale and polish. The scaling with ultrasonic scaler is what actually disrupts that bacterial biofilm and gets that cemented junk off of the tooth. But it also puts a bunch of scratches into the tooth, so we always have to buff it out with a polisher. You know, when you go to the dentist, it's that little paste they use to buff out your teeth. And what that does is it removes all the tiny microscopic scratches that the scaling and cleaning process has put into the tooth. Now, if you don't polish the tooth afterwards, the tooth surface is left rough, and bacteria have a super easy time of attaching back on. You know, attachment by bacteria to your body surfaces is one of the major pathogenic mechanisms. A good way to think about it is like if you want to stain a piece of wood, you rough it up with a little bit of sandpaper, and that way any stain or paint adheres to it better. Exactly the same thing with dental health. If you leave a tooth that's been microscopically scratched or abraded and you don't buff it out, then the bacteria have a super easy time of reattaching. And in fact, this is what happens. The teeth look good for a little while, and then the dental disease just comes back with a vengeance because the bacteria haven't really been disrupted that much, and then the damage to the enamel leads to much worse periodontal disease than has ever existed there before. Hurting the animal, failing to bring any health benefits to it, and making the animal really, really reluctant to be touched around the head and mouth. And I see this all the time. I see animals, most of the time I can walk up to like any cat and dog, stick my hands in their mouth, look at their teeth, it's not a problem. Occasionally I get animals that we call as head shy, where I go towards them and the dogs will snap and the cats will freak out and they'll hate having their mouth touched. And most of the time that's because they've had anesthetic-free dentistry attempted on them. And also, sometimes I look in the mouth and I'll see teeth that look pretty, they look clean, but the gums are absolutely trashed and inflamed. And I'm like, I used to get caught out by this when I first started. I'm like, well, that's kind of weird. And then I asked the client, and like, oh, have you ever had your dog's or cat's teeth cleaned without anesthetic? And they say yes. And then it becomes obvious because it looks better, but it's not better. And a lot of these animals end up losing all their teeth towards the end of their life because they have a horribly unhealthy mouth. It's an absolute tragedy that this is permitted to happen, but it's very common because, of course, anesthetics are scary and expensive, and people love having this like gentle, not scary, not much cheaper option, but it's not really an option. It's animal abuse, it's fraud. Your animal is getting messed up if you take them to one of these people, and unfortunately the veterinary associations do not do an effective job of regulating this at all. I mean, I can only speak for what's happening in the province of BC, but I'm sure North America wide, this is a problem where the veterinary associations simply don't have the influence and the resources to regulate, groomers and some random people with a metal pick in their hand, former human dental techs who project themselves or advertise themselves as veterinary dentists, who are all maybe very well-meaning people, but also very misguided people. Who basically hurt your animal for money and do absolutely no good to it, and in fact harm its oral health. So don't get sucked in by the concept of anesthetic-free animal dentistry. It doesn't exist. It is simply animal abuse and fraud, and I will stand by that. Absolutely terrible thing that the only way to fight it is through education, because there's no regulatory means to stop it from happening. We just have to educate people, spread the word that anesthetic-free dentistry is animal abuse. I've explained to you so far why dental care is important, how we assess a mouth, how often we need to provide dental care, and what we look for to make the decision about when it'll benefit the patient to go under anesthetic and have their teeth cleaned. And you as an owner can play a big role in this, because I mean, as I tell my clients, I show them what inflammation of the gums looks like. I'm like, you can look at this, you can look in your pet's mouth anytime you want. If you see red line where that gum meets a tooth, if you see gingivitis, it's time to get those teeth cleaned. It's a matter of education, and you guys can make that call almost as easily as I can. You may have trouble discriminating some of the minor nuances of dental disease, but I think anybody can really look at a pet's mouth and say, hey, I need my vet to look at this. I think my pet is ready for dental cleaning. It's really not that complicated. At the end of the day, gingivitis gets better with scaling and polishing. So if you have gingivitis, you should do scaling and polishing, right? And it's also important to be really proactive about dental health. As I said earlier in the video, it's all about keeping those gums healthy and keeping them from receding, because when they recede, they don't come back, and then when they recede, the tooth roots get exposed, and that's when you start losing teeth. So it's really important to be proactive, and doing multiple prophylactic dentals throughout your pet's life is infinitely preferable to waiting till the mouth gets really, really rotten and then having to deal with like multiple extractions and really severe periodontal disease. Because you're not saving money by delaying the dental. You're not reducing your pet's anesthetic risk at all by delaying a dental, and I'll touch on that in a moment. There's really no benefit to delaying dental care, and we know that pets are going to be healthier and your lifetime expenditures on dental care are going to be lower if you're proactive about getting those teeth cleaned regularly throughout your pet's life, rather than waiting till the end of life when they have periodontal issues, they have severe disease, and they might also have other diseases, other comorbidities that might make anesthetics more complicated, or they might make just the dental care more complicated. Let's talk about anesthesia, because this is one concern I get a lot from people when I say that their pet needs dental care. People always worry about the anesthetic, which is reasonable, because of course anytime we do anesthesia there is some risk involved, but realistically in a well-run veterinary hospital the risk of anesthesia or a negative anesthetic events is like roughly 1 in 100,000, which is pretty much what it is in a human facility. So if we do our job right, we can achieve that. And it's, you always have to look at the risk and the benefit when you're making these calls. And most of the time when people are worried about anesthetic risks, it's not really warranted, because it's not like your option is to do dental care or not do dental care. Usually the choice is between doing a prophylactic dental cleaning now or waiting till things get absolutely terrible 3 years from now and doing it then. And at that point, not only are you going to be looking at like a much longer time on that anesthetic, much more invasive procedure, but you're also going to be looking at a patient that's going to be older and, if anything, a worse anesthetic risk. So there absolutely is tremendous value to getting prophylactic cleanings done. And if you want to manage your pet's lifetime anesthetic risk, then do dental cleanings early and do them often. Because here's the thing people don't really realize is that there's no increased risk in repeated anesthetics. When they do anesthetic safety studies, they will anesthetize patients like every day for 30 days. And we know from these studies that there's absolutely no risk from doing anesthetic even on consequent days. There is an increased risk in a duration of anesthesia and the complexity of the procedure you do under anesthesia. And again, this is pretty minor, but often when we're looking at like advanced dental procedures, we're looking at extractions that can take 2, 3, 4 hours, as opposed to a dental cleaning which takes 30 to 45 minutes. So there is a significant increase in anesthetic risk there. And in fact, I will sometimes, if I have an unstable patient, break up the anesthetic into 2 or more sessions. What I'm saying is anesthetic risk is a reasonable concern, and every anesthetic should be approached with the respected warrants, whether it's something simple like a cat neuter or something complex like removing a part of somebody's liver or knee surgery. Anesthesia is anesthesia, but when it comes to dentistry, more is actually more. Doing more frequent, shorter procedures on young animals that prevent that severe periodontal disease, prevent the need for those 4-hour-long multi-tooth extractions later in life, is actually greatly reducing your pet's lifetime anesthetic risk. And just so we're clear, I have absolutely no problem doing multi-hour extractions on 19, 20-year-old cats with kidney disease and heart disease, because I know that A, I can design an anesthetic that is safe and effective and they're still going to do well under it. Statistically speaking, of course, there'll always be that one in, maybe at this point, maybe 1 in 10,000 rather than 1 in 100,000 that won't do well. But I know that what we're doing is of great benefit to the patient. I know that not doing the anesthetic, not doing the procedure, will result in more animal suffering and more disease in the long term. So I have absolutely no problem providing dental care to older patients. Age has really, I know that if you look at the paper, if you look at it scientifically, age does increase anesthetic risk. But practically, that increase in anesthetic risk, at least in pets, in my opinion, is not significant, meaning that other factors like systemic disease play a much more important role. I am 100% comfortable putting a 20-year-old cat under anesthetic to clean their teeth if their blood work checks out, if their physical exam checks out, if they have good control of whatever health issues they have. And I do this all the time with excellent results. And yeah, sometimes at that point you may need to spend 2 or 3 hours under anesthesia pulling multiple teeth, doing complex extractions, and that's okay if the anesthesia is done right, if you select your patients correctly, and it does benefit them significantly. So please don't let your pet's age be a deciding factor in this. And I know that some vets express a little more temerity towards anesthesia than me. It's just a level of competency and comfort. So if your vet's concerned about doing your pet's anesthetic, ask for a referral to a specialist dentist. Ask for a referral to a specialty center with their anesthesiologists who are maybe more comfortable doing anesthesia than your family veterinarian, because that should not prevent your pet from getting the health care that they need. Hey, Mr. Lance. All right, so if you sat through this whole video, now you should have a pretty good idea about why we clean animal teeth, how often we do it, and what's involved in doing it. Feel free to leave me questions in the comments below. I will do my best to answer some specific questions, although, as always, Please don't ask me clinical stuff. You know, that's really between you and your vet. Unless you want to go to my Patreon and book a proper consult with me. I do second opinion consults, but not in YouTube comments. So thank you for watching. Please have a look at your cats or your dogs' teeth. When you're done, look for that red line, and if you see it, go talk to your vet. And thank you again for watching. For me and Sir Lancelot and the rest of my fluffy crew. And now for 20 minutes of me cuddling Lancelot. This is what the video is really all about. We're just going to sit here for an hour. Okay, we can seriously cut now.